Now, all this means that health is a central, very central policy issue in Europe, because it's the heart of the welfare state, often because it's just the most ancient part. For generations, people have had free access to care, or for very little money, they could have health care. And also because so they're used to it, they wouldn't renounce to it. And you have the solidarity principle behind, which means you contribute according to your means and you receive according to your need. This is a word of I forgot the name, I'm sorry, some philosopher who was a socialist philosopher in the beginning of the 20th century, who said a just society should be that everybody pays in according to its means, taxes, percentage of your income, and you receive according to your needs. Let's say education, you have one child, you get education for one child. If you have 10 children, you get education for 10 children for the same taxes you paid, because that's on your means. So in health policy, this is the solidarity principle. You pay contributions for the social health insurance when they are compulsory according to your income. This is not so with private health insurance, but this is a sort of most of the European people. You pay according to your income and you receive according what you need. And then you don't look how much did the person pay in. If this person is very ill, needs very, very costly treatment, the treatment will be given because it's need. Well, afterwards, you have management problems, regulating problems, budget problems, but the principle is this. Now, for the individual citizen, like you and me, it means you have every day the experience of democracy. If you are ill, you make the experience that you are respected, your need is respected. The doctor will, will examine and he will give you what you need. Not all the policy sectors are like this. That's very special to health. It is a practical experience of equal treatment. At least in the hospitals I have known, there was equal treatment. Nobody asked me for my social status in order to grade my treatment. I was treated exactly the same way than any person richer than me or poorer than me. And it's somehow a reality, an experience of reality of human dignity and rights. And that's very special to health. Maybe education has a little bit of this, but then the results are more long-term. So this is to say that healthcare in the most advanced healthcare systems in Europe is experienced as part of citizenship. Because I'm a citizen of Europe, I get this healthcare. And the result is healthcare has strong support from public opinion. And that is expressed in voters. So if you want to be a politician in France or in Germany, but don't attack the healthcare system, you won't be elected. So, but then health policy is a very complex and one could say borderless field. It's difficult to govern. It's a big challenge for policymakers and managers, even managers on the ground, because healthcare has many, many dimensions and they're all equally important and they have all a lot of contradiction between them. So just to name a few, there are anthropological, symbolic, and cultural dimensions to health and healthcare, political and social dimensions. The COVID epidemic showed us this, economic and financial dimensions, institutional and organizational issues, management and human resources. I mean, you need about 12 years to train a doctor. So you have to have planning far ahead and you have to have the financial means to do so, the faculties, etc. You have territorial and geographical issues, or rural areas, mountain valleys, which you have to deserve also and provide healthcare to the population, even if the population is very much cut off from main transport routes. There are scientific dimensions, research development, and industrial dimensions. Just think of the pharmaceutical industry. We had this problem with COVID. We didn't have masks because we didn't have factories anymore in Europe who would make masks. And communication and information. Just think about health education and prevention, the messages you have to do. that people accept vaccination or things like this. There's a whole science of communication, information behind. So all these dimensions are part of health policy, and they have all to be considered when you make health policy. Now, just a few words on the anthropological and symbolic dimensions to make you understand the importance for people of health. It's highly emotional because it concerns illness, birth, death, suffering, and well-being. And it has strong symbolism. Just think about all the symbols that the word blood is carrying: good blood, bad blood, noble blood, blood fluids, body fluids, sex, procreation, fear of contamination, fear of death, hope for a long life. All this is highly psychological and emotionally. And if something goes wrong in the healthcare sector, you have immediately a risk of a big scandal, at least in Europe, because the media, they like medical dramas and they are feeding scandals. So, and this plays on this highly emotional dimension about anything that concerns health and illness. And then you have really issues like every country has different cultures with minorities, and they have different ideas about what the body is and what good health is and what you should do with your body or not do, whether you can have abortions or not abortions, whether you can give blood transfusions or not to children and so on. And these ethical questions, they don't have consensual responses, so there will be fighting around it. For instance, we have in France and also in Germany cases about religious minorities who don't accept blood transfusion for some religious idea. Now imagine, and it happens from time to time, that a child has had an accident, a car crash or whatever, and needs a blood transfusion, and the parents say, no, the child can't have a blood transfusion. And the doctor says, well, without it, it will die. So who should be responsible for take the decision whether the child will be saved or not? Whether the cultural issues will be first, the parents' private choices, or the public duty of a doctor. So all these symbolic things are not just, philosophy. It does have concrete issues with real people in real hospitals. So all this is to tell you governments may encounter absolutely unpredictable high-level public reactions when they have to tackle health issues for all sorts of reasons. Now the health sector is embedded, now this is sort of, you can guess it already, has a multiple embeddedness in society. So if you look here at the center, you will have the health sector. So policy decisions will be taken and doctors will work and people will take all sorts of actions. So here you have the hospitals, the general practitioner and everything. Around these people that enables them to do their work, there's an institutional context. There's the health insurance or the public health administration with all the rules. Then we have an economic context, and that explains you why within Europe, within the European Union, we have very different healthcare systems with different levels of universal access, because there are richer countries and poorer countries. And this has an impact on the money the countries can put into the healthcare system. So you have a political context, right and left, and all sorts of different political programs. When there's election, candidates may want to cut down the public service or may want to develop it. So all this will have an impact on the people who work here in this healthcare system via budgets and investment and working rules. When France decided that we have unemployment, that was in the 80s, and we should cut the working time in order to share work, that was a socialist idea. And they cut the working hours, the weekly hours, from 40 hours down to 35 with the same salary. Okay, we still have this law. Well, there are ways to go a little bit around it with supplementary hours to pay more, but it created a huge disorganization in the hospitals because suddenly doctors who used to stay on duty all weekend, sleeping in the hospitals, they were forbidden to stay in the hospital longer than 35 hours a week. It was absolutely a drama. And our hospital problems really started because of this law cutting the working hours down. Nobody thought about this when they did it. It was a socialist idea to cut down working hours in order to share work and fight unemployment. It had nothing to do with hospitals. But this context, this political context, created enormous problems here, which are still not totally solved. And you have a cultural context, of course, what is acceptable or desirable in different cultures according concerning health. Easy example would be, I grew up in different cultures, and different cultures, Germany, France, Britain, they consider medicine maybe a bit different. I don't take much medicine because I was not used to it when I was small. When a child doesn't sleep in Germany, when I was a child, you would sing a song to the child and try to calm it. When I arrived in France, I learned to take the child to the doctor and we get some medicine to sleep. So these are completely different responses to the same thing. And you have healthcare systems which are very much medicalized. Everything is a medical problem. If somebody is stressed, you will see a doctor to get pills. Or you have a context where people say, oh, well, I better take a walk in the forest or take 2 days off and wouldn't think about medicine. So there's also the little story about a French child coming to, I think it was Britain, for a school exchange for language. And the holiday parents, so this English family, was absolutely shocked when they opened the suitcase. It was full of medicine and pills. And they didn't understand. They thought this child is terribly ill because of all this medicine. And no, it was just the parents of the French child gave this in the suitcase, all the sort of normal medicine eventually the child would need. Didn't even think that there would also be medicine and doctors in Britain. So it's just to give you an example, there are countries where culturally you are very much inclined to use a medical system and others where you do it much less. So this is, and all this will come into your health policy. You will have to have a bigger budget for pharmaceutical products or a smaller one. All this it's important. The problem is you have to know it. Generally, people who live in one country don't know all this because they are used to a certain thing and don't know that their country is over-consuming medicine or under-consuming medicine. Now, the health policy field, you can also look in how it's organized from the inside. Well, you have a very similar picture. Here, let's say you have the hospitals and the medical care. Then you have around it the social security institutions because it provides the funding, secures access, sickness leave, and all the administration. The administration of this system one comes largely from this circle number 2 on the social security. Third would be prevention. Here you would have the hospitals and the system where you are cured from illness, and here all what's prevention, which has nothing to do or not much with medical work. Or your surveillance for cancer or vaccination, all these things. All these public actions that have as a direct goal to keep people healthy. So anti-tobacco campaign, anti-alcohol campaign, sexually transmitted infection, vaccination, you would have in this circle number 3, which is of course larger because other institutions come in here, not only doctors. All the public health institutions and new professions, even people who are specialists of communication. Then you have a circle number 4, which is policies with health impact. So if you have a policy on food or pollution or environmental issues, it has an impact indirectly on health status of the population. So the healthcare system would like maybe to say the people who work here, they would like to be consulted for the policies that are made here. And that's the dialogue is not always very easy. Just think about agriculture. The all the pesticides in the agriculture to produce more is what the agricultural industry wants to do. It's normal, but it creates a lot of health problems, and they are seen here. They're not seen here. So, but it's all part of health policy. If you don't want these health problems linked with pesticides, then you should have an action here in Circle 4, not so much here. So these are these interdependencies I want to show you here. And the last circle, which seems to be very far away from this one, is all the health industries, the pharmaceutical industry, the medical equipment industry, those who construct hospitals, and so on. And this is very important to remember this, because this means a lot of employment. This is where people work. So an example, if you want to cut to better regulate the health expenditure, we had experiences in Germany and France and so on, trying to cut the consumption of medicines. Or there was some overconsumption, bad prescriptions, sort of educate the doctors that certain medicines are not so necessary and so on. So the medical consumption went down a little bit. But there were pharmaceutical industries who were producing 1 or 2 products which were under this public policy to be cut down, and they had to close their factory. And unemployment came out of it. So they shouted around that the health policy is destroying their employment. And if you look into the employment figures of the healthcare system, you have about, I looked at figures up yesterday, about 9% of the working force who is actively employed in the healthcare system. That means here in the Circle 1 and 2, the administration, the social security and all this. Maybe part of the people who are working in 3, but there are not so many people working on prevention. So, but if you add all these people who are working in the industries, private industries for the healthcare sector, who make the beds, who make the hospitals, who make the medicines, then it's something like 15 or 20% of the working population. So this is also one of the things which makes health policy, which makes the health sector grow. Always more doctors, always more care, because behind there's a drive for employment and industry, industrial interests. So a good health policy would need to balance all these different dimensions. So good luck to you if one day you will be a big health manager for the students or health minister. You will have to manage all this equilibrium.